I think when it comes to a patient making a large personal decision that could impact their life, we feel we have to be very transparent on the pros and cons of that treatment. We feel that patients will find the place that they feel most comfortable with if the people are transparent and tell them exactly the risks of having treatment done. This is a different message than I normally share, but I really urge anyone that's considering full teeth replacement to hear it. I've been a dentist for over 30 years, probably 31 now. Considering that dental implants have been around for a long time, I mean the first implants that were placed were probably over 50, 60 years ago, but it wasn't anything that was taught in college or at university. So from a technical point of view, we had zero learning at university in dental implants. And over time, I suppose after you graduate, you like to learn things that are different, and I suppose the advancements of where technology and science went to is that then we started doing a lot of work, and I started doing a lot of work around cosmetics and dental implants. And I suppose I started learning about dental implants over 20 years ago now. So the first implant I placed was in Sweden, and that was back in 2001. Full teeth replacement really came from the problems of having dentures and the problems of what would happen if you had dentures and how the dentures would move, and I suppose there's the embarrassment and pain and problems eating, of course. So when dental implants first came out, it was a very slow process. We were looking at sometimes up to 9 to 12 months before a patient got a set of teeth. And it was implants replaced that were then held in the mouth for a period of 6 months, and then they would then slowly fabricate the teeth, and it would take at least 9 to 12 months to get a set of teeth. And over the last, say, 15, 20 years is when technology has moved to the point now where we're able to place implants and load them immediately. And that changed the game quite a lot, because now we've got to the stage where we can place an implant and put teeth on top within a very short period of time, and it can be anywhere between the time of surgery all the way through to even just a couple of days. So I suppose full teeth replacement, or all-on-4 or all-on-X as we call it now, is a type or a concept of treatment where we're actually removing teeth or placing dental implants, and within a very short period of time putting a full set of teeth on. So we're loading the implants right away, and we're really able then to have a patient go from having no teeth or having failed teeth to having a new set of teeth in a very short period of time. So I think personally I'm pretty shy naturally, but I think what I realised is if I had a service that people didn't know about, there's no way of being able to share that service or to change people's lives. So about 20 years ago I actually started doing TV ads, and I was probably one of the very first dentists to start talking about dentistry as something that we could, or a service that we could actually give patients, but it was based around more to do with cosmetics and dental implants. So it's treatment that's very elective, it's very optional, and I realised that it was such a shift for people to get this treatment done. It wasn't just like normal treatment, it wasn't like a filling or a toothache or a root canal or braces. It was when patients chose to do elective treatment, so they would then make a conscious decision for themselves that they wanted to do something for their mouth and their appearance or their health. And then we started doing a lot of TV ads, and we started to actually use the internet. Recently, the government bodies have actually put in some protocols in order to ensure that patients get all the information they need to make an informed decision. And unfortunately, if patients are pressured into getting treatment, especially when it comes to maybe special offers, or it comes to getting this treatment done as soon as possible, or not having enough time to consider what the pros and cons of the treatment are, what happens is patients are then kind of almost forced to a certain way to have a treatment. And when that happens, it usually leads to a lot more complications and a lot more problems. I think when it comes to a patient making a large personal decision that could impact their life, we feel we have to be very transparent on the pros and cons of that treatment. For example, if a patient at all feels uncomfortable or feels like they need more information, we will literally say to the patient to seek a second opinion. We feel that patients will find the place that they feel most comfortable with if the people are transparent and tell them exactly the risks of having treatment done. And we go through multiple steps, not only in the consultation, we have a consent visit where we will go through and talk patients through what the consent is so that they understand fully the ongoing maintenance that needs to be done with their smile and their teeth, and also understands the immediate risk of having treatment. And that's critical because then patients can balance between the pros and cons and the risks of getting treatment done, so they make the right decision when they do have treatment. And I think it puts patients at ease when they understand all of those risks, and they understand too that if things do go wrong, they're in a place that will support them through and get them through if there is any problems that happen with their treatment. So I suppose because marketing is so much easier, I mean online presence and things like that is so easy, the benefits of treatment are actually being used a lot to tag a patient and to get a patient to actually have treatment done. But the underlying message for patients is that this is a very complex procedure. This is something that one needs to be considered carefully, and everyone's individual health and their goals and their expectations are very unique. So we really have to make sure that the gap between, okay, these are all the benefits that could come about from treatment, and also what the patient knows from an information point of view and actually understands the risks that are actually involved, that needs to be covered very, very carefully. Because if it's missed, what happens is patients then accept treatment too early without understanding the consequences, and we know the consequences are major, and what happens then of course is that things can go very, very wrong. For the first 5 years of being a dentist, you're probably doing a lot of general dentistry, and then for the next 5 years, you're really trying to work out or hone in on which areas of dentistry you, one, enjoy, and secondly, that you would like to learn more about. And in that time, you would probably do things like maybe a tiny bit of cosmetics, or maybe do the single implant. The problem we have is when you think that doing a single implant and doing 4 or 6 implants means that you just need the experience from one implant in order to just do 4 or 6 implants, and it's not really like that. When you start to then do multiple implants, you're looking at the mouth more holistically. You need to consider everything: the bite, the way the teeth sit, the lip support, the gum position. There's so much more fundamentally that you need, and on top of that, you need a very unique team. Because when you're doing complex treatment, the patient needs to be asleep, so you need an anaesthetist, you need lab technicians, you need a whole team that can do digital smile design, you need a CAD/CAM designer. There are so many other people that you may not understand that are in the background, and that team takes a long time to actually establish and to understand and get the experience to either be able to handle these complex cases, but to also make the experience for the patient as unique as possible.